Hi, my name is Emily Lopez and today's date is February 11, 2018. I'm going to be talking about the axial skeleton. I'm going to be pointing out the axial skeleton and the appendicular skeleton. The axial skeleton consists of the anterior, posterior, lateral, inferior skull, as well as the thoracic cage and the vertebrate column. The appendicular skeleton consists of the pectoral girdle and the upper limbs, the hands and the wrists, the pelvic girdle and the lower limbs, as well as the ankle and the foot. So let's point out the appendicular skeleton first. The hands and the wrist. These are the phalanges. This is the sesamoid. Right here, these sesamoid, see these two little bones? Sesamoid bones right here. These are the metacarpals. The hamate, pisiform here towards the edge. Right here is the trichotrum. Next to the trichotrum is the lunate. Here. Next to the lunate is the scaphoid. A little below the scaphoid is the trapezium. This is the capitate, and this is the trapezoid, right here. So let's point out the ankle and the foot. These are the phalanges. These are the metatarsals. This is the cuboid. This is the lateral cuneiform. This is the calcaneus, the talus, the navicular. This is the intermediate cuneiform here, and this is the medial cuneiform right here. So now we're going to talk about the pectoral girdle and the upper limbs. The pectoral girdle is the clavicle, scapula, humerus, radius. This is the radius, and this is the ulna. Radius, ulna. Now the pelvic girdle and the lower limbs. Ilium, pubic bone, ischium, femur, patella, tibia, and fibula. Now that we pointed out the appendicular skeleton, we're going to point out the axial skeleton. Anterior skull, frontal, ethmoid, lacrimal, nasal, sphenoid, here and here, zygomatic, maxilla, mandible, and the vomer. Posterior skull, parietal, occipital, temporal, mandible. Lateral skull, frontal, parietal, occipital, temporal, zygomatic. Ethmoid is inside the eye. After ethmoid is the lacrimal, nasal, maxilla, and mandible, the chin. Inferior skull. I'm not sure if you can see this, but the inferior skull has the occipital here, parietal, temporal, sphenoid, ethmoid, and frontal. Now the vertebral column. The first vertebrae is the atlas, the second is the axis. The first 7 vertebrae, 1, 2, 3, 4, 5, 6, 7, is the cervical vertebrae. The next 12 are the thoracic vertebrae. And the last 5, 1, 2, 3, 4, 5, is the lumbar vertebrae. This is the sacrum and this is the coccyx. Thoracic cage. This is the manubrium sternum and this is the body of the sternum. These ribs that are attached to the sternum body are the true ribs because they're attached to the sternum. These last 3 ribs here are called false ribs because they're attached to the costal cartilage as opposed to attached to the sternum body. These last 2 ribs are called floating ribs because they're not attached to anything in the front, they're only attached to the back. They're also considered false ribs. And that concludes me pointing out the appendicular skeleton as well as the axial skeleton.